International is a humanitarian group dedicated to expanding global access to health care, and they are right in the middle of this Ebola issue and Ebola treatment in Liberia. And we welcome Jim Mitchum, the CEO of Heart to Heart. In light of that special report and in light of where we're at now, we were talking about it as we were watching the report. The key may not lie within our borders. The key lies in Africa.
That's right, Joel. The opportunity is to stop this disease at the source. And that's what we also heard from Dr. Lee Norman, the the chief medical officer for KU Hospital, who said yesterday very clearly, we need to stop this in West Africa. Don't let it get out.
The headline in the New York Times today about Liberia was life, death, and a grim routine, waiting to see who has Ebola, waiting to see what can be done about it. What's Heart to Heart trying to do in this, what looks like, it feels like a global crisis, but it's not quite that yet, but it feels like it to a lot of folks.
It's very much a regional crisis at this point, and we want to keep it that way. Heart to Heart has been shipping medical supplies, those things which are necessary for the medical workers to treat Ebola patients. And we're going to continue to do that, but going a step further, we're going to go in and open and operate a 70-bed Ebola treatment unit outside of Monrovia. And in that situation, we'll be taking Ebola patients, isolating them from the community. The key here is isolation. If we don't isolate these patients, then they can infect other people. So you need to get them into ETUs where they can then recover, hopefully, and many of them will pass, and that way we can prevent it from spreading to their friends, their neighbors, and all of the relatives that they would have infected at home.
And this is, I was reading over the weekend, this is a culture that communicates through touch and through embracing each other and through being there physically for one another. And if you see your son or daughter with a raging temperature, how can you not go over and want to comfort that son and daughter? And yet it is that physical connection that then spreads the disease there. The fluids that get passed through sweat and tears and everything else.
Yes, I mean, it is a bodily fluid transmission. The risk of communicableness compared to, say, measles is much, much lower.
Right.
But it will be spread in families very easily because of that constant touch. And yes, you're right. Culturally, that is a big barrier for treatment. And that's why we need to get these people out of their homes and into ETUs where we can care for them and hopefully help them remain alive and prevent them from having more contact with their family.
So Heart to Heart is reaching into the heart of this issue in Liberia and other parts of Africa, and people can help do that. But we just saw the special report, and you know very well that this is going to make people in this country panic and nervous and worried. And what would you say to them as a professional, a health professional that deals with this kind of global question? What should we take away from that report?
It's obviously a concern, and I understand and appreciate that. But I think as our own health authorities have told us, that the actual risk for U.S. citizens is extremely low. We do need tighter controls at the border. We do need better monitoring of people. And certainly the healthcare workers that we're working with will be protected in a way that very few people understand. We're not seeing these health workers doing what we're going to be doing, coming down with Ebola. The fact is they are very protected. They run with strict protocols. When those people come back, just the few that are Americans who will be overseeing the Liberians who are doing most of the work, those people come back, they'll be following a strict CDC protocol to make sure that they are monitored and nothing happens that could infect somebody else.
And we need to keep in mind that to really attack this, we have to go to Africa. It has to be Africa. That's the beginning, and that's the place that it needs to be treated and dealt with.
Absolutely, Joel. We have to be there. We have to stop it. We don't want it getting out of Africa.
And if you want to help, and who doesn't want to help? Heart to Heart is such a great organization. You might be able to be of some help, financially, certainly. I mean, this is a high-dollar situation. So we're going to have a link to their website on ours in just a little bit, and you can go there and you can help Heart to Heart in any way possible. We thank you for being here.
Joel, thank you for letting me come.
And we'll be back in just a minute.